Yeah. Hi, Miss Irene.
Hi, beautiful London.
Hi, beautiful Irene. You beautiful.
You beautiful too, my mommy.
Yeah. So what are we getting ready to do? Talk about health.
Hi, London.
Hi. We're talking about health, right?
Yes, we're talking about all the health things going on during this pandemic and
Oh, yeah.
before, during. And we're hoping that after this, we can learn some lessons as a country and our medical community, and even just as a patient, we can learn some lessons about what we can do for our own health.
Yeah.
Um, yeah, trying to take charge of our own health.
Yeah. I guess I could say this could be part of it. Our London's Love, Care, and Share. Talking about the health things. So what part of the health are we talking about right now? How to take care of ourselves in this pandemic?
Yes. Um, yes, let's talk about that because that's a serious thing, and just how to take care of ourselves and how to interact with the medical community. I know some people are thinking, of course, we champion all of our medical people that are helping us right now. We thank them so much for putting
Yeah.
themselves in harm's way. We call them the frontliners. Of course, I always thank all of the delivery people, the grocery people, and just everybody that's doing the frontline work. There's other people to be named that I can't think of right now, but just say all the frontliners. We thank you.
Everybody, yeah.
Sometimes the medical community, I don't know if they always understand or get it right, or sometimes they may be driven by the bottom line, just like any other business. So I hope nobody gets me for saying that, but I mean, from past experience, we know that the medical community can, they're just a business, just like any other business in a way.
Yeah. Yeah,
So
that's
what?
true. I was talking about something the other day, how a lot of times people that are going to the doctor, we don't know that we have a choice after a doctor tells us something, and if it just doesn't feel right, or if you don't understand it, then you shouldn't agree to do anything till you get a full understanding. And then if you really feel, yeah, also you can also mention to the doctor what you would like for the doctor to do and what you like for them not to do. I learned that long saying to you till you check the situation out. And I was saying a lot of times they don't feel like they have any authority over making decisions for themselves when they're talking to a doctor. Some people say get a second opinion and all that. If you don't feel right about something, you shouldn't do it. You can actually the doctor can advise you, and then you can also advise the doctor on how you feel and what you'd rather do. Sometimes they require you to take certain tests, and sometimes if you're not sick, I don't think you should just take tests because it's being suggested. There's a lot of good doctors out there, but it's also another angle that deals with making money. I think a lot of people know that. Some tests they want you to have, some shots they want you to have, and you're doing. I'm just saying, if you're not ill, if you're not sick, then you shouldn't. Like people say, if it's not broke, don't fix it. Leave it alone.
Yes, but I do want to let people know that you should still do your annual checkups, even if you're not feeling sick. See your doctor once or twice a
Yeah.
year.
Hmm.
Continue to do that,
Yeah.
because they might see something that you don't know. But I also feel like the medical community, doctors, we put them at such a high place as far as being such smart geniuses that we just feel like whatever they say is like it's absolutely 100. But like our people of faith always say, we have to believe the report of the Lord first before we believe anything that the doctors say. Of course, common sense and listen to your doctor, of course, but as somebody I know, Miss Pastor here, give her a shout out. She said, don't let them speak negative reports on you, especially
Yeah.
if it hasn't manifested in your body and you don't feel it, then don't let them speak that negativity on you.
Yes, that's true. 'Cause yeah, that's a good one right there because a lot of times they will say something negative. Even if you have a condition, I've seen them speak down instead of encouraging you and everything, telling you you're not gonna last too long. This is gonna you're gonna go downhill. This and that. I just think that they shouldn't talk like that to the patient. They should you're gonna treat the patient, but also encourage the patient, and not because when a doctor, it's almost I call it medical witchcraft because the spirit. I've seen it happen to my family where they just kind of like dropping that spirit down in you, and I have to correct them and stop them. I start stopping them from talking negative. You're not going to say something positive. I always bring up God, let them know we're believers in God, and you don't have the last say over this situation. You know, and some of them still want to insist, and I just keep telling. We each one of us have to be more positive about ourselves. But that's part of how it goes. Someone, sometimes people just literally they might pass away because the doctor gave them some bad news, and they said, "Well, you're not gonna live too long anyway," and that's giving up. I think one of the doctors say a lot of people do pass away because they just give up and they don't fight. They stop fighting and give up. And so, you know, if your mind gives out and gives down, and you start feeling weak, you start feeling sad, you start feeling depressed, your immune system starts to go down. If you already have a medical condition, then once it starts to go down, you can incur some more contract other diseases. It can cause issues with your body and stress you out to the point where, something like that could happen. So, the first thing, like you said, is man, we need to really trust in God, and whenever we go, just pray and trust God. I mean, He's the only one that's the keeper anyway, and then ask God to just bless you with a good physician that's going to listen to you. And even if a physician is a little different, I've even gone and prayed with the physician. I pray for myself, and I'm praying for them, my family member. God can come in there and turn things around, clear the air. And there is people respect God, even if they have other thoughts to add to them. If they know that you trust in God, you bring God up and even pray for them. Everybody likes prayer most of the time. Everybody need, in my experience, when you say let's pray, it's not a negative prayer. It's a prayer to bless the patient. It's a prayer to bless the doctors. It's a prayer to bless the nurses and anything that has to do with that present situation, and ask God to bless them and keep them. And everybody wants to be uplifted in God, and God come in and change that spirit
Yes.
and bring out about a spirit of positivity.
Yes, and just when you go, just always take God with you. It's not, He has the last say. Just keep that in your mind and your heart whenever you go to the doctor. But still go, because there's some people with the mindset of God will just heal me, and they may or may not have made any positive changes in their lifestyle or how they're taking care of themselves either, and they just assume that God is going to fix this, but then they also haven't really put any work in either, and they haven't seen their doctor. It's like a combo pack that you kind of have to address all the areas: spiritual, physical, mental. Go see the doctor, speak life over yourself. But first of all,
Balance things out, yes.
God about it and just ask Him for the best outcome. And I want to say to the young people out there, when I was in my 30s, hey, I'm 40, you guys. I turned 40,
You
but
look like a little baby to me. 20.
I'm happy, I'm happy to be 40. I told somebody I still feel like I'm 30 now, but when I was in my 30s, and most of my life, like, I had no health issues whatsoever. So I did neglect going to the doctor. I didn't have all my insurance stuff right and together. So that's one reason. And then the other reason, I just didn't ever feel like there was really a major reason to go. Like, unless something was really big, like, I didn't really go. I didn't do checkups or anything like that. So I got this major diagnosis of cancer, and that changed my life. So I want the young people to know go to see your doctor just because you're young don't mean that it's all good. Even in this pandemic, I think it's some young people walking around like, I'm young and they said it's only older people that can be affected and I could just go do what I want. But don't take that mindset, because then we see the flip side of all these little kids getting these other strange disorders connected to the coronavirus. So, it doesn't matter your age, you still need medical help. And then it's kind of tricky right now because um, a lot of the facilities are closed. Unless you have any type of coronavirus symptoms, you really can't get any other medical attention. So we're kind of in a place now where you kind of self-diagnose. I mean, I won't say that. You can still call your doctors, but you need to also like pray and look at some things you can do at home, some healthy lifestyle changes you can do. So we're kind of like at the point where it's you and God in this pandemic, and you and God and your family, and that's it. And you can't really talk to the doctor right now. So what do you do in that
Good
case?
afternoon. I'm not one to do live anything or to have anything to say in a public forum, but as a nurse of over 35 years, I am greatly concerned. I work in the healthcare field right here in the Washington, D.C. area, and I'm seeing a trend that I want to bring to the attention of my fellow Black Americans, Black Caribbean folks, Blacks of any kind or shape, wherever you come from, that I think you all need to be aware of. That is, for folks who are showing symptoms of COVID 19, our symptoms as Blacks are different. You don't have a cough, you don't have a temperature, yet our folks are dying at a higher rate than any other nationality or group. And that is because instead of a fever and a cough, what our folks are showing up with is what we in healthcare call malaise, or you just don't feel right. And on top of that, what happens is you start having either pain in an extremity or you just start feeling a little winded. Guess what? If this is happening to you, you need not to go lay down. The clock is ticking. This coronavirus brings on bleeding inside our bodies, whether it's in our extremities, in our hearts, or in our lungs, causing blood clots. And that's what's killing our Black feet, folks. Now, if you can't get to a doctor, then you need to get up and walk. You need to start taking deep breaths as much as possible. Use some of your old home remedies. You know how your granny used to give you the garlic and the lemon and the ginger? Make yourself a poultice of onions. Put it on your chest. But it's by time that we start doing something for ourselves. We are losing our Black males, especially, faster than the doctors and the lawyers can pick them up. And the reason for that is one of the symptoms that is very common among our Black men is pain in the muscles. And guys, no pun intended, most men, when they start to have a pain of any kind, wants to lay down. This is not the time to lay down. If you lay down, your lungs is filling with blood. And when that blood starts clotting, you can no longer pass oxygen to your bloodstream. So I'm no major doctor, but I've seen too many die in the last couple of weeks like this. And if you really start thinking, you go back as far as February where we started finding people in their beds dead. And it really seems like it's that virus that was already in our community. So, black folks, don't get stupid because they tell you you got your stimulus check and you're going out to go get your hair done or your nails done. Please protect yourselves, not just for you, but for your family. Let us be wise about what we're doing. We know we're always the group they're ready to do experiment on, or the group that they feel is dispensable. It's time we start taking care of ourselves. Please pass this information on to your friends and families. We need to do better. We need to take care of ourselves. We need to make sure that we're getting enough rest, eating properly, cover your nose and mouth. But more importantly, if you don't have to go out, stay home. I have too many nurses who work under me who are now out because they've been infected. Healthcare workers do not want to do this. And it's not fair to ask them to give their lives when you're not doing your part. Let's stop the craziness. Let's show them that we are no better or no worse than anybody else. Please pass the message on. Let's stop the coronavirus dead in its tracks. Let's cover each other with prayer, but let us be intelligent about what we need to do. Thank you for taking the time to listen.